Therapy, everybody. As many of you know, October is National Breast Cancer Awareness Month, but did you know that today, the 17th, is Breast Reconstruction Awareness Day? With more on the options, please welcome Dr. Paul Gill from Gill Plastic Surgery and his patient, Dana Clark, who is currently undergoing chemotherapy, and survivor, Laura Lee Hedrick. Please welcome them to the show. Hello. Ladies and you, I want to start with, because we always talk about the beginning is, of course, early detection, but I want to start with how you found out that you had breast cancer.
Long story, but I actually felt it myself. So I was lucky enough. My tumor was actually raised towards my skin instead of further back towards my chest wall, so it was very noticeable to the touch.
And Laura Lee, yours was kind of a fluke.
Mine was a fluke. I went in for my regular mammogram. And they had the brand new 3D imaging. I took advantage of the 3D imaging, and they found three very small pin lumps that probably would not have been detected for another 18 to 24 months up the road. So yeah, got it very early.
Which one was you? Somebody hugged you.
That was me.
Okay, that was you. Okay, yeah, because yours was kind of, it was a strange situation where somebody hugged you and you had a tag on that.
One of my coworkers actually did it, and our badges at work are metal on the back, and he hugged me tight enough that it pinched, and it hurt for several days, and then like 3 days later, that same exact spot, that's where I found the lump.
Okay, so you get the diagnosis, and for a lot of women, they're just a flurry of, you know, things in their mind. First is, I want to live, right? And we certainly know that today, because of technology, we have many more survivors than we've ever had before, so amen to that. But then starts the process of, all right, what do I want to do now? And doctor, for some women, if they have their breast removed, they're done, and that's fine. But for other women, they want to kind of make it like it was, if you will, just so that clothes can fit better and things like that.
Well, I think, you know, October 17th being Breast Cancer Reconstruction Awareness Day, this is the first inaugural day all throughout the country. Today, the American Society of Plastic Surgeons has sponsored a day dedicated to educating patients on what really breast reconstruction is. And every woman has a choice. Our job is to make sure it's the most informed and educated opinion. And, you know, women such as Dana, such as Laura Lee, we've actually set up in many hospitals multidisciplinary meetings where you have an oncologist, a radiation doctor, a general surgeon, and a plastic surgeon all meet and discuss these cases together.
So it's not really done after the fact. It's like you're all part of the process. Yeah.
And that's a wonderful concept because it allows us all to preemptively plan, because as these women can tell you, breast cancer it comes with a lot of different choices, and what we want to do is help guide each patient individually to the best decision possible.
Right.
And, you know, and I think they can attest to that.
Yeah. All right. Let's talk about the DIEP flap breast reconstruction and how that works.
So there's multiple options, and it's really dependent on the patient, their body habitus, and also the type of cancer they have. So a DIEP flap is essentially what's called a deep inferior epigastric perforator flap. Now, if we can pause that real quick, essentially what we're doing is doing a tummy tuck, taking the skin and fat and preserving the muscle. The old way of doing this, we used to take the skin and fat as if a tummy tuck and the rectus, or the six-pack muscle, and kind of swing it like a pendulum to make a breast. Problem with that was 11% of patients had hernias or abdominal wall weakness. So in 1992, a Dr. Robert Allen, who I had the opportunity to train with also, invented this procedure. And what it does, it takes this skin and fat. What is a breast? Skin and fat. What is tummy tissue? Skin and fat.
And a lot of us have a little extra on that tummy, don't we?
That's why we can help. And we basically preserve this muscle and take the blood supply and reconnect it with an operating microscope to the chest wall. And in our opinion, that allows the patient to utilize their own tissue to reconstruct a breast. And, you know, down the road, the advantage of this is it doesn't rupture. It doesn't, you know, cause a, you know, so you don't have to worry about capsular contracture or some of the risk with implants.
It's you know, autologous really. It's your own
stuff. It's your tissue. It's you know, it's the most natural reconstruction we can offer a patient.
Well, so others will opt for having the actual implant.
Correct.
So tell us how that procedure works.
So the implant procedure basically involves, depending on the patient anatomy, whether the nipple areola needs to be removed. In some stages, we can do a single stage where we place the implant directly. In some cases, such as Dana, we have to place an expander to regain some of that skin that's lost with the mastectomy and then replace it with an implant. And you know, the advantage of this is it's quick, not a lot of downtime, you know, there's not a lot of short-term risk, but the downside is long-term, you know, there can be some sequelae. But with this, we've actually, over the last year or two, been able to add procedures such as fat grafting, where we take liposuction areas from the hips, the back, and kind of layer the...
This sounded like a little twofer deal. Sounded like a twofer deal for me.
Yeah, we can talk. And so we kind of layer the cake and essentially take away that implant look. So it's allowing us to make a more natural breast.
I want to ask you, Dana and Lauralee, why was it important for you to do the reconstruction?
For myself, emotionally, to wake up and actually have breasts and not have anything there, I can't even begin to tell you how much easier the process has been, because they've always been there. I've not had to deal with them not being there.
Right.
No crying, no tears, no nothing. It's been
nothing
good.
to remind you.
Nothing.
Yeah. All right, Lauralee?
I think when you go through the surgery, I mean, I just remember when I first found out, first of all, it's like a whirlwind, and it takes your breath away. And I was like, I didn't want to be that way. You know, I still wanted to feel good about myself.
Make it like it was type of thing.
And I'm the one that had the first surgery. I have this breast is made out of this stomach. So
this very flat stomach, I must say. All right. I want to pop on over real quickly to Michelle Klein, who is the patient care coordinator, which this is such a vital role in a doctor's office. And so tell us just basically what you do for women who might be thinking about this. Sometimes you're the first line that they come to.
Sure, yeah. That's definitely a big part of it, is we're that first line of communication. So, you know, the patients will call in and they'll tell us their story, and really our goal is just to get them in the door fast, because time is of the essence in some cases. You know, most patients will have a subsequent, you know, surgery or other treatment plan, so we need to get them in, meet with Dr. Gill so he can go over the reconstructive options.
Yeah. And you get it. You understand. You get it.
We understand it. We know the whole process, pre and post-op and everything in between. So really it's about educating them too, being that open line of communication so they can call us, bounce ideas off of us, and then ultimately get them scheduled and, you know, plan everything that way, where they're coordinating with all the doctors that Dr. Gill spoke about. You know, there's a lot that goes into it, so we just try to make it easy on them. And then ultimately post-op care too. We'll see them for that and watch them through every step of their journey and make sure that, you know, we're getting to know them on a personal level and see what they're going through too. So it's a big part of it.
Thank you very much. Thank you all for sharing this with us. And in honor of Breast Cancer Awareness Month and Reconstruction Awareness Day, Dr. Gill has a special offer. Bring in a mammogram report this month, and you'll receive $500 off a cosmetic breast procedure. And that's just, of course, for anyone, right? Oh,
That's
well,
right.
Look at that. Just bring your mammogram in to prove that you've been checked. Keep in mind, this is not combinable with any other offer, but yeah, bring in that mammogram, get your mammogram. Thank you very much. Dr. Gill's office is located in the Woodlands. For more information, call 281-853-5308, 281-853-5308, or visit him online at drpaulgill.com. Also, if you'd like more on Breast Reconstruction Awareness Day, you can go to bra-day.com. And speaking of the fight against breast cancer, we want you to be a part of Great Day Houston's Breast Friends campaign. Schedule your annual mammogram and encourage your girlfriends, mothers, aunts, whoever, what female you love. Make a day of it and plan something fun to do after. Did you know when you get your exam at the Rose, it is covered by insurance? When you get yours covered by insurance or you self-pay, you make it possible for women who cannot afford to get a mammogram to get one. You could literally save a life by going to the Rose. Email the stories of how you and your girlfriends decided to get your mammograms and what you did afterwards, shopping, lunching, whatever, to kind of take the fear out of it. All right. Well, our address is greatdayhouston@khou.com. Do you get tired throughout the day and need a pick-me-up? A snack might help. Next, the item sure to give you a big energy boost without packing in the calories.